Recording in progress.
Hello, everybody, and welcome to Functional Medicine with me, Dr. Howard Robbins. Uh, this show is dedicated to helping you get rid of medical problems in a safe, natural, and effective way. Safe and effective are the two key words here. I don't really have a lot of time to spend today other than on the show, so we're going to get right into things. First, I have to thank Promo Life, and it's very important. Get a pen and paper ready. I'll give you their number later on. Promo Life makes many important ozone products, particularly ozonated glycerin, what this show is dedicated to. And best thing to do is to call them and tell them what you want. And as you're going to learn, you're going to want ozonated glycerin. And I got you it's not expensive, but I got you a good 15% discount if you use the coupon code Robbins, my last name, Robins. You could probably just use it at checkout, and that may work just as well. And you're going to learn why ozonated glycerin, and they make way superior. I've talked about it with the owner, so I know they're making it in a very superior way. For those of you that are watching me, you see me I have a stethoscope around my neck. I just thought I would do that this show, because all doctors that do podcasts seem to have their pictures with stethoscopes around their neck. I don't think anybody does that, except maybe in an ER where you might have to do it. Normally, you just stick it in your pocket and you pull it out if you need it. But everybody seems to think that if you're a doctor, you have to have a stethoscope around your neck. Trust me, you don't. Okay? Particularly the kind of medicine that I practice, ozone therapy. So I also want to thank my other sponsor, Doctor's Biome. I'll give you a minute or two on that because it's very important that you get Doctor's Biome. Doctor's Biome is a very special probiotic beverage. It has 15 proprietary patented strains that are created. The next generation bacteria is created to survive the stomach over 90%. I promise you, your capsule, your tablets, even powdered probiotics are virtually worthless. They're almost completely destroyed in your stomach. If they come out of suspended animation, because they're not living. And that's what Doctor's Biome has, living probiotics in a 100% organic vegetable fruit juice. It's delicious. There's virtually no sugar and absolutely no alcohol in it. So absolutely a wonderful product to take because it's created to stick to the wall of your gut. Not only are they next generation bacteria, they're also called smart probiotics. And when you go to doctorsbiome.com, I'll spell it doctorsbiome.com, and you put the code radio20 in, you'll get 20% off your order. After that, you can get 10% off your order if you use the code Howard35, my first name, Howard35, and you'll get 10. You can't use both codes at the same time. Don't try. But you can get 10% off your order after that. And if you go on auto ship, you'll get another 10% off your order. So anyway, that helps you out. Doctorsbiome.com, very, very important. I'm going to get right into the show because there's never enough time, and I'm hoping that we'll be able to finish this up today. So if you haven't listened to the show that I did last week, listen to the show last week. It's part 1 on ozonated glycerin. And I go over what glycerin is. It's an alcohol sugar, and that it's approved for medical use in various ways, and it has benefits. Then the bright idea came literally over a century ago, to ozonate it. And when you ozonate it, things change. Basically, when they start to pump ozone gas into glycerin. And Promolife uses an ultra pure organic ozonate glycerin to start with, in a special setup, so that it's going to be ultra pure. And this is very important if you want to use it medically. So they pump it in over several days, and after several days, at room temperature, the glycerin starts to pick up the ozone. And the way you know that it gets fully ozonated is that its weight changes, it gains in weight. And what's interesting and important about it is that it has a tremendous holds a tremendous amount of ozone per ml. Normally, ozone is measured in micrograms, mcgs. Each ml of glycerin holds 10 milligrams. That's 10,000 micrograms of ozone. That's humongous. That's unbelievable in terms of the amount. When we use the gas intravenously, and that's what we do, that's all that I do. I've been doing intravenous ozone therapy for the last 34 of my 52 years as a doctor. And now that's all we do. It's amazingly beneficial at getting rid of just about everything. Virus, fungus, yeast, mold, bacteria, parasites, toxins, harmful free radicals are all destroyed by it. It can remove toxic metals from the body, particularly when we put the gas directly in. We don't know if ozonated glycerin is going to chelate the same way. That remains to be seen, because it has to be tested to prove that. But certainly the direct IV method, which we've done over 370,000 times out of my 420,000, definitely does that. And it also is extremely effective at getting rid of tumors and things like that in the body, whether they are benign or non-benign. And I have to be very careful in the way I speak, because these shows are now being put up on my YouTube channel, Functional Medicine with Dr. Robbins, which you may be watching. And then you get to see me, not just hear me. Well, in any case, if you use that C word which I'm afraid to even spell on YouTube, they take the show down. So let's just say it can get rid of tumors that are benign and non-benign. And I think everybody knows what non-benign lumps and bumps in the body really means. And that's going to be hopefully my way around it, so that this show can get posted there. Fortunately, you can hear it here on Voice America without a problem. I can say that C word. So that's why ozonated glycerin is becoming important in ozone medicine today, because of all these beneficial effects. It's antiviral, antibacterial, antifungal, antiprotozoal, anti-inflammatory, and anti-neoplastic. So it has all these amazing, amazing benefits. And even at room temperature, and by the way, when people ask what is room temperature, if I ask them that question, they go, 72, 73, 4 degrees, 70 degrees. Actually, room temperature is whatever temperature the room is. If you happen to be in Alaska with the window open in the winter, it could be 0 degrees. But normally you think of room temperature as in the 72 degree range. And even at room temperature, it holds its half-life. That means the glycerin will keep the full potency for 3 months, for 90 days, before it denigrates down some halfway. Refrigerated, you could probably keep it a year or more and get benefit and get the same full benefit from it. And what they do when they what you can do if you have the right meters and everything to evaluate it, you can get an ORP reading, an ORP reading. That's an oxidative reduction potential. Okay. And ozonated water, for example, has an ORP value of about 550. So if you have an ozone machine generator for home use, which you can get from Promolife, it has that ORP value. Well, if you get the make ozonated glycerin, it has an ORP value of over 600. So it's very powerful in the way it can work. And there are many, many different uses for it. Most of the research that's been done, mostly in Japan, as you heard from the last show, was on animals, and it was for these non-benign tumors in animals, and it showed amazing benefits for them. I'm hoping non-benign is a safe way to say these things. If not, at least you all heard it here. Basically, glycerin is one half of a glucose molecule, one half of a sugar molecule. And because it has bonds that ozone can be attracted to, it's able to pick up all this extra ozone. And it's been used in, so many ways. One study showed it had amazing antifungal and yeast benefits. They took one experiment, took yeast, and at the typically 10 parts per million of ozonated glycerin, and basically completely destroyed it. Okay. And it's been used to complete, and they did another study also. This was published just a few years ago. Now you have to hunt for these things, but we were able to come up with it. They did studies, repeated studies, to show that it kept working, so that the bacteria couldn't develop a resistance to it, which is important. And it was able to eliminate MRSA, staph, which I've done with direct IV ozone anyway. MRSA and staph, E. coli. E. coli, is a very potent bacteria that you see. You can get in the stomach. You can cause stomach problems. You can get it urinary tract infections. Legionella and Klebsiella. So all these particularly horrible bacterias were able to be destroyed by it. And there's various ways you can use it. It has very potent anti-inflammatory effects. I've had a skin rash on my ankle. It's called neurodermatitis, aggravation. Worries, aggravation, and whatnot causes it to, this rash to develop. I've been dealing with these kinds of issues off and on since I went to college, worrying about exams, worrying about all sorts of things. This is how my body tries to get rid of the tension and anxiety. And the itch is pretty bad. When I put on the ozonated glycerin, it stops it within minutes. My buddy Rowan, Robert Rowan, had painful and burning rash from shingles, and when he put it on, stopped it completely. Robert will tell you that, and it's just very, very potent and amazing. What happens for example, in your mouth? If you have gum disease, gingivitis, there are bacteria there. And the ozonated glycerin, what you can do, it has tremendous uses in dentistry. You can take some of it out And what you want to do is try, even though it'll kill anything that goes in it, you want to extract it. Get yourself some syringes, of course, without needles. You can get them in any pharmacy today, like they use for babies. And you just put the head of, wipe the head down with some peroxide, and then just stick it near the neck of the bottle, tilt it slightly, and then start sucking in the glycerin. And hopefully you'll be able to suck it in because it's very thick and viscous. And when you suck it in, you could take a couple of cc's of it, 1 or 2 cc's, and then you put it in your mouth and just swish it around your gums. And it's going to kill gingival bacteria, all right, in an amazing, powerful way. Even just putting it on healthy skin will increase your healthy skin's markers to show that you develop an increased benefit. Your skin cells that get exposed to it have an increased benefit. There's increases in NRF2 and in GSH and hemooxygenase 1. If you understand what I just said, you'll see that it's tremendously beneficial at creating that skin barrier. Here's what we're going to do. We're going to go to our first commercial break, and when we come back, we'll continue talking about its benefits and its uses. So stay with us. We'll be right back.
Recording in progress.
Hello, everybody, and welcome back once again to Functional Medicine with Dr. Robbins. And we're talking about the benefits of using intravenous, actually, various benefits of using ozonated glycerin. So I started with the mouth, and where you could take some and swish it around your gums. If you happen to have a problem with your tongue, for example, you might have yeast in your tongue. If it's white, God forbid it's black, which real severe thrush. Remember, you got to fix your gut to get rid of that. This kind of thing can cause bad breath. There's bacteria that cause bad breath, and you want to make sure if you're going to, that you're able to use ozonated glycerin to help kill off these harmful bacteria in your mouth, the gum disease that may be causing that, and at the same time, yeast on your tongue. But if you don't use doctor's biome to fix your gut, you'll never fix your mouth. You need a healthy gut to have a healthy mouth, and actually you need a healthy mouth to have a healthy gut. So you can't ignore dental disease and dental problems just for whatever the reasons are that you want to try and ignore them. The key in life is to grow old and be well. It's not about growing old. It's easy to grow old these days because of pharmaceutical medicine, but to grow old and be well so you don't wind up in a nursing home or where you're able to stay home and take care of yourself, that's another whole story. And you got to work on that. That doesn't just come naturally because you think you're doing all the right things. So even if you want to, so basically, let's stay with the human body first. So with your mouth, so you swish this all around. If you want to, you can mix it with some distilled water. One part of the ozonated glycerin to maybe 3 parts of distilled water, and you can actually use it on this that to rinse your mouth with. That might even be a little bit easier, and you can make up a bunch of it. I would refrigerate it, definitely. That would be beneficial to refrigerate it if you can. I like to use glass with ozonated glycerin, not plastic, because I believe it can react with the plastic, and I don't believe that's safe. It has to be tested to be proven safe, and that's why Promolife is making it in uh, these dark purple glass bottles to prevent light from damaging, getting in and causing any damage. I don't want air getting in very much because air is loaded with junk. So a narrow-necked bottle is important to prevent air from getting in of any quantity to react with the ozonated glycerin, which will react with air. Okay. It's just about maintaining its real powerful value. And that's why Promolife has done a wonderful job. I'm very, very pleased with what they have done. So I can use it, as we're going to get to eventually, intravenously. For your face, okay, perhaps you have acne, um, uh, rashes on your face, whatever. Again, 1 part of ozonated glycerin. Let's say you take one ounce of ozonated glycerin and 3 ounces of water. That'll liquefy it a lot more. And then keep your hands washed very clean, or you can put it on a pad, some gauze pads, sterile gauze pads or whatever, and then you can wash your face down with it, particularly if you have acne happening. You could also use it if you're, God forbid, having a shingles outbreak on shingles that way. It might be easier to put on, and maybe you could just spill some on that way. And that might help reduce the inflammation and pain from the shingles. We know that it can be used in eyes, but we're not going to recommend that you do that because there's not been enough safety testing, nor is there a really great formula for it. With eyes, you got to be very careful, so I am not recommending the use of it for eye problems at this time. That may change, but not at this time. Let's see, we did eyes. So skin, wounds. You can make it into normally for wounds, I've been using, if you heard my wound care show, which you can go back and listen to, organic ozonated hemp oil. Here you can use the organic ozonated glycerin, OGG. OG you're going to hear OG everywhere now. A lot of people are talking about it. Ozonated glycerin is very powerful, very wonderful. And OGG I just made that up. It's organic ozonated glycerin. It's the kind Promolife makes. And by the way, their phone number is 888-742-3404. 888-742-3404. I hope this doesn't sound like an infomercial, but it's important that you be able to get this product, and I want you to get the best. There is no doubt this is, right now, because of the extent that they've gone to making this, ideally, it is the best of the products that you can get from anybody out there. There's going to be a lot of companies making it because there's money in it, but theirs is the best. And if you give them you use the coupon code ROBINS, ROBINS, you'll get 15% off your order. I don't get anything out of that. I want to be crystal clear. There's no kickbacks here. There's no percentages coming to me. I don't work that way. This way I can denigrate somebody as much as laudate them if I feel they deserve it. So you can apply it to wounds that way, and then with sterile gauze, and then do evaporating wet dressings to treat wounds of various kinds. I don't know if you put the straight glycerin on the wound, if it may cause because it's very potent and it has a very low pH. Remember, neutral is 7.0 pH. And glycerin normally has a 6 pH, okay, a 6.0. Ozonated glycerin is generally about 1.5 to 2. So it's highly acidic. Which means that it can help if you can get it down to your stomach. I'm hoping they're going to be able to make capsules of this so that people can treat stomach problems, stomach ulcers, stomach infections with the ozonated glycerin, but the capsule has to be able to open up in the stomach. That's the catch. You might be able to make your own at home. You can buy capsules, I know, on the internet, and maybe fill it. Fill it. Get one of those little syringes and squeeze a little bit in and make capsules of your own, and that may help. I believe it's going to help with stomach ulcers and various stomach infections that people can get, like H. pylori, for example. It's easily going to destroy that. All right. So putting it on wounds directly may be maybe too much. Ozonated hemp oil is fine, but I find if I've used it even on good skin, it can have a reaction with skin because it's extremely potent. The ORP value of ozonated hemp oil is tremendous. So with ozonated glycerin, I'd rather use it in that slightly watered down state. And I think it might be a lot safer and a lot more comfortable. Now, on your face, and this is something that I'm using it for right now, I have some age spots here, and I don't water it down because it doesn't burn my skin. It doesn't feel uncomfortable at all. And I'm able to put it on my skin. I rub it in gently once a day right now. Soon I'm going to try twice a day. It stays greasy feeling. It's not greasy, but it stays greasy feeling and sticky for quite some time. It doesn't just go away. But they have used it. There's a study showing that it'll lighten skin spots. Takes about 8 weeks. It's not instantaneous, the lightening of it. So keep that in mind. You have to keep using it. Remember, it's going to, with skin again, it's going to improve your skin's barrier function, to prevent things from getting in. It provides deep hydration to the skin, kills infection in the skin. It'll help reduce redness, and though it may initially cause redness and inflammation in the skin, it comes down very dramatically. Okay. It has, depending on the concentration you're using, very good antiseptic properties. So you can use it on little cuts and small wounds and stuff very easily. So with skin, I feel, and for rashes, tremendously powerful to use it for rashes. So all those are the some of the external uses of it. We've talked about it in the mouth. Particularly use it after you go to see your dentist and you get a cleaning or you've had some dental work done. Swishing your mouth with the ozonated glycerin, and then I'd like to use, after something like that, use the actual thicker glycerin itself and just, squeeze a cc or two into your mouth and swish it around and let your tongue use it to coat all the gums, behind your teeth, in front of your teeth. You know how you can move your tongue around. And I believe that it'll help prevent infections, kill off the infections in there, get rid of, if it's not coming from your stomach, bad breath. Had tremendous dental applications. Let's talk about intravenous IOG, intravenous ozonated glycerin. Well, I'm setting up for it in the office as we speak on this show. Probably within a week of this show being aired, I'll be able to begin using it in the office. There are already colleagues of mine using it all around this country. I don't believe it's being used or at least I don't know of it being used right now in Europe or any place else, and I don't know who's doing it and what they're doing with it in Japan. other than on animals. But here it's begun to be used, and we're starting to get some feedback as to reactions that people are having and things like that. The good news is, unless you're allergic to it, which is easy enough to test for, you can do a skin test, a muscle strength test, and an AK test. Unless you're allergic to it, I'm expecting nothing but wonderful results. The question is the concentrations being used and the purity that's being used. Now, when I say purity, I am not concerned about transmitting some horrible infection with it because it's going to kill everything. The questions right now are what concentration should we use? Should it be used with sterile, water, or should it be used with sterile saline intravenously? How much to put in? Is another very important question that we're first beginning to look into. And there's been a formula that people have, so to speak, that we've been taught, and I have decided, because I take Dr. Do No Harm very, very seriously. Here in New York, my state board probably doesn't care if I kill anybody with a pharmaceutical. If I hurt one person with ozone, I'm out of business. Worse than that, I have to go to sleep at night. I think I've said this on other shows. I am not the kind of doctor that can hurt a person and go to sleep at night. It's just who I am. So, what I've learned is, and I've always been known to push the envelope. I'm always on the edge. The ozone world with direct IV thinks I'm insane with the concentrations and volumes that I use and the way I use it. But I've learned to use it safely and effectively and never hurt anybody. That's the important thing. Well, I decided that, and I'm going with my gut on this, not going with my intellect, but just with my gut, that instead of hitting people initially with full blast, we're going to do things in an intelligent and sensible way. Now, all my patients have to do direct IV first. So we already know they're not allergic to ozone. They're not going to have a problem from this because ozonated glycerin holds so much medicine. And it can go, when we use it intravenously, it may hold up for a very long periods of time, and that's one of the things we're looking into. If we're using it intravenously, does it get metabolized and utilized instantly? Or is it going to last for several days and work around your body? Is it going to stimulate the antioxidant enzymes to be made in large amounts, which we believe it does? But is it going to stimulate, how long will that stimulation last for? So your own body's immune system has been kicked in, like with other ozone therapies, like the direct IV that we do so much, with 10-pass that we do so much. So we have to figure out these things before we hit people with humongous doses just to see if we can hurt you at the same time trying to help you. And I will never do that. You can always trust one thing. We're going to get you well. We will do no harm. We may not help your problem, but we're absolutely not going to hurt you. No moral and ethical doctor should ever promise and guarantee a result anyway, even if you're successful 10,000 patients in a row. You never know what's going to happen on the next one for some reason. But I want my patients to get benefited, and I have to protect them. And I take care of my patients and treat them in a very, very careful and protective way. All of them have my cell number. If they have reactions, they have to call me right away so we can discuss how to adjust the medicine. Remember, ozone is just medicine. Ozonated glycerin is just medicine, and you have to adjust the dosage appropriately. Fortunately, we can use it on children as well as adults. We just adjust the amount. But We're going to be starting off with an effective but safe amount, and with each intravenous infusion that we're going to be doing only once a week, will build you up. Now, on the other days, they'll be able to get the direct IV, so I know they're going to be benefiting tremendously. And it may be that the ozonated glycerin drip, which is going to take about an hour compared to a DIV, which takes only a couple of minutes, may turn out to be superior, or it may not. We have to, everything is results, clinically based. Today when we lecture, we use what we call evidence-based medicine. Okay, what have we seen clinically? It's not what academically anything says anymore. It's interesting because if you want to get something to be used and approved, you have to do it academically. You have to do it as part of research studies and public, and it has to be published in peer-reviewed journals, which I am published in. Then you can get doctors to use it. But when you lecture, doctors are less concerned about these studies that we put up on the screen, and they're more concerned with the reactions, the benefits, the uses. That's what they're mostly concerned about. So evidence-based medicine. And so with glycerin, OG, we're just starting to learn what it can really do, because unless you do it in an appreciable number of treatments and amount, you don't really know. One doctor had a severe kill-off, Herx reaction from it, which we see from direct IV. So I'm not fearful of that. If you don't know what herxing is, it's your body can't get rid of the waste fast enough that's been created. And that's why my patients are prepared, and this doctor's patient may not have been prepared, because I get little to no herxing now whatsoever, mild herxing. Once in a blue moon do we get a severe herx, where you feel feverish chills, almost like you're getting a flu for a few hours to a day. In a moderate to severe herx, you just feel like sleeping, you feel tired, and then that rebounds after so many minutes or hours. You know what? Let's go to our last commercial break, and then we're going to start talking about its medical uses for more serious problems. Everybody stay with us. We'll be right back.
Recording in progress.
Hello, everybody. We're back again. We're talking about ozonated glycerin, OG, and we're now talking about IOG, intravenous ozonated glycerin. So what are we going to be using it for? Virtually just about everything. My expectation is that it's going to be an extremely powerful treatment for Lyme disease. I've done special shows on Lyme. Because of all the various bacteria, there's a humongous amount of junk in the body that we have to kill off. Ozone in all its forms intravenously have been beneficial against it. I just have a feeling this is going to be extremely potent against it. And I'm cautioning that all the doctors start off with half the IV dose. Normally, you do 1 ml of ozonated glycerin per 5 pounds of body weight. So, but you don't want to, if you have a 300-pound person, you don't want to start giving, 120 mLs of glycerin. You have to ozonated glycerin. You have to adjust appropriately. And I believe being safe says be a little bit more conservative. So that's how it's safe for children. But I would start with, and we're going to be starting with half that dose and see how people do. If there's no problem, we'll increase it the next time, and then finally give them that full volume of ozonated glycerin, presuming there's been no adverse effects. The key is to prevent adverse effects, and people can have a severe herxum. Trust me, while it's not harmful, it's not wonderful either, and you want to prevent that from happening. We've learned how to prepare our patients properly for it. And one of those things, and there are three things my patients, and we're going to have everybody do, and that is, the first is to be well hydrated. So if you're a doctor listening to this show, which we do have, if you're going to somebody and he doesn't or she doesn't know this, you tell them. Okay, tell them to listen to the show, but unfortunately, egos can get in the way. So with ozonated glycerin, it doesn't matter to me what IV ozone we're doing. I need you to be well hydrated. The human body is over 70+% water in almost any organ or tissue, no less than 60. So being well hydrated, you should be putting away as an adult 3 to 4 liters, 3 to 4 quarts, 3/4 to as much as a gallon of water a day. Okay, sounds like a lot, but that's what the human body needs. Secondly, vitamin C. Okay, now I've gone on other shows talking about all these things in greater detail. We've done special shows on vitamin C. With vitamin C, you want to do it 5 or 6 times a day, every couple of hours while you're awake. Get a quality vitamin C. Cheap vitamin C generally comes from corn. Sometimes expensive vitamin C comes from corn and it's just crap. But you want to get a quality vitamin C, so buy it from a quality company. Don't go by price alone or ease. There are many different high-quality vitamin supplement companies that make vitamin C in various ways. Liposomal C, if you get a high-quality one, is excellent. There are buffered powdered vitamin Cs that are excellent. Nobody pays me for commercial time, so I'm not going to give you names and brands that we use in the office that we keep available for people there. What else to say? Oh, you need to take it every 2 hours because your body, if it absorbs it well, utilizes it, okay, over a 2-hour span and then urinates the rest away. So it has to be bioabsorbable, bioavailable. That means your cells can uptake it, and then bioutilizable, so that when it's in your cells, the cells can do something with it. And that's why high quality C is so important. In any case, that's the story with that. And so every 2 hours while you're awake, and stop with the excess water and the vitamin C 2 hours before bedtime, because you need your sleep. So if 2 hours before bed, that's the cutoff mark. You did as much as you could do that day and you're done. Lastly, you have to put the good boys back in your gut, because ozone intravenously attacking everything from the inside out is going to attack the biome that's in your gut. Mostly we have yeast that may be overgrowing. Most everybody listening to this show has. And that's why doctor's biome becomes so important, because it puts the good boys back in the wall of the gut and helps get yeast in balance. And that's doing it from the outside in. Ozonated glycerin is going to attack candidiasis from the inside out and hopefully get intestinal yeast in balance again. And that's why, but it'll also kill the good boys off also. It kills all bacteria. So you have to put the good boys back in. That's the important thing. You have to put them back in. So importantly, get Doctor's Biome. I'm not going to tell you where to go again later on. So when I end this show, it'll be done. Go to doctorsbiome.com. And make sure you put the code radio 20 in. You'll get 20% off your first order. And then you could use the code Howard 35 for future orders. Okay, Howard 35 for future orders, getting 10% off, and auto ship, you can get another 10% off, so you can keep that 20% discount coming. And it's worth every penny, and it comes with a 100% money back guarantee. It's delicious. Your children will love it. Okay, saying enough about that. Let's continue on. I expect it's going to work on viruses because it's already been tested on the COVID virus. I'm spelling it because I'm hoping that the computer on YouTube isn't going to pick that up and throw it out and throw the show out. And ozone has been proven to be effective against that virus as well as other viruses, particularly in the direct IV way. I'm hoping and anticipating that it's going to be great against HSV 1 and 2, herpes 1 and 2, the cold sore genital outbreaks that people get. And we're going to be using that and recommending it to all our patients. I expect it's going to be great against shingles. Okay, amazingly beneficial against in the treatment of shingles intravenously. And we're going to give it in a very slow and simple way. This way we can monitor people. Big 500 ml bag with between, depending on your weight and size, between 15 and 30 mLs of the organic ozonated ultra pure glycerin that I get from PromoLife for this. And we'll see what the benefits are over the next few months. And I'm expecting nothing but amazing results. That's all there is to it. We see a lot of other things in the office that we're going to be using it on. Obviously, it's been tested on benign and non-benign things in the body very extensively and show nothing but wonderful results. So we're going to be using it on those things as well. If patients have it, that is, it'll benefit them. I'm not an oncologist, so I don't treat those things. But if you have it and you're in our office getting it, it ought to be able to get rid of it or help reduce it. And that's what we're anticipating and expecting based on literally several dozen research studies published predominantly in Japan on that particular problem. In terms of, oh my God, there's so many things that it'll be beneficial for. How about kidney problems? The kidneys suffer from all sorts of inflammations and infections. This should be a tremendous advantage. Why? Because not just for kidney problems, but for all problems that we're treating. 10-pass, hyperbaric high dose ozone with multipass. 10-pass is where you take blood out, ozonate it, put it back in. Listen to my show called Intravenous Ozone Therapy, Everything You Need to Know, where I go over all the different methods and why we use the ones we use. Well, the problem with the blood methods of ozone is it requires big, strong veins, a blood needle. The EBU, extracorporeal blood ozonation oxygenation, RHP, it's also called, recirculatory hemoperfusion. EBU, where all your blood gets dialysized through an ozone machine, so to speak, and cleaned. These things requires one big strong vein in each arm. 3 out of 10 patients don't have it. But with ozonated glycerin, we can use little itty bitty baby angiocaths so that we can get little itty bitty baby veins in your arms and do it in a safe way, just like a vitamin C drip, a comfortable treatment. So I'm believing that we're going to be able to work on virtually 10 out of 10, 19 out of 20. 99 out of 100 patients ought to be able to get ozonated glycerin for their medical problems. And that's why we're going to see liver problems and kidney problems, um, uh, pancreatic problems be diminished. It'll also have an effect on diabetes, where it'll have a transient lowering of the blood sugar. That's why with diabetics, the doctors are gonna have to be a little bit more careful in their dosing of this to see how it's going to have an antiglycemic effect. And if its antiglycemic effect is going to be too, severe, people who are insulin dependent or taking various medications for it may have to adjust for it. So that's going to be a very interesting and important thing for docs to watch out for, and patients who have diabetes. If you're listening to this and your doctor wants to do it, make certain you discuss that with them so you put something in their minds they may not have thought about. I'm not sure if I'm going to do another show on this. So make sure you tell everybody to listen to these two shows. I'm going to go over my notes and make sure that I didn't leave anything out of importance that I want to discuss, and then we'll decide whether we should do a third show on this or not sometime in the near future or even next week. In any case, if you need to speak with me, you can call my office in Manhattan at 212-581-0101. That's 212-581-0101. Or email me at ozonedoctor, OZONEDOCTOR, ozonedoctor at yahoo.com, YAHOO at yahoo.com. They'll give you, or I'll give you, my cell number, and this way we can speak and discuss everything and answer your questions that way. If you have a suggestion for somebody that you'd like to see on the show or a topic you'd like us to discuss, email me at ozonedoctor at yahoo, and we'll look into it and hopefully put it up on a show to come. Okay? For everybody, please forgive me for not being a techie. If some of this show, if you're watching this or listening, isn't perfect, don't blame it on Matt at the studio, and don't blame it on anybody but me. I'm going to learn to be a better techie one of these days. I'll be 77 in a few weeks, and I'm hoping to catch up to everybody who's 2 years old who could be a better techie than I am. Everybody stay healthy, stay well, and we'll be back again next week.